Selamat petang, good evening, ladies and gentlemen. So sorry that my bahasa Indonesia tak bagus. Okay, please allow me to present, to share some breast cancer knowledge, general knowledge in English, simple English, so that everyone can understand. Okay, I'm so glad to see you all again, friends from Indonesia. In the conjunction of October, as what Mr. Allen have said, a breast cancer awareness month, I would like to share something about breast cancer. Let me share, yeah. Can everyone see my slide?
Yes.
Okay. All right, tonight, this evening, yeah, I'm going to share about breast cancer. So what is breast cancer? Okay, breast cancer occurs when some breast cells, the cells, okay, begin to grow abnormally. All right, not healthy. Okay, not healthily anymore. It grow abnormally. This cell divides more rapidly than healthy cells do. Okay, and continue to accumulate, forming a lump or a mass. Okay, cells may spread through the breast to the lymph node and to other parts of our body. Okay, the spreading process we call metastasis. Okay, breast cancer most often begins with a cell in the milk producing ducts. In medical terms, they call it invasive ductal carcinoma. I will show you a picture. Okay, come, let's look at the breast structure. First thing you can see, the milk duct. Okay, this is the milk producing duct. Okay, they have lobules. Lobules is the glands to produce milk, and milk duct is the tube to carry the milk to the nipple. All right, so the tumor, you can see I have the square box. Okay, the tumor. Okay, the tumor already occurred. Okay, in the lobules. Okay, it is how our tumor starts. It is how our breast cancer starts. All right, so what is actually cancer cell? Okay, cancer is the uncontrolled growth of abnormal cells in the body. And the abnormal cells grown can be known as tumor. So meaning when people say cancer, it is actually referring to tumor. Okay, some types of cancer do not form a tumor such as leukemia or lymphoma or myeloma. Those cancer are white blood cancer. Okay, white blood cells cancer. So look at the tumor. The different color of these cells, this is actually a skin layer, okay? But you can see the different color cells here is actually a tumor, okay? The tumor is referring to cancer, okay? The cancer cell start dividing and to produce more cancer cell, eventually a lump, all right? And it will continue to grow by cell dividing, okay? So how does cancer cell begin? Cells are basic units that make up the human body, and cells grow and divide to make a new cells. I will show you picture again. Okay, and old cells or damaged cells will die eventually. Okay, cancer begins when genetic changes interfere with the cell's division process and cells to grow uncontrollably. These cells may form a mass or tissue called a tumor. Again, a tumor can be cancerous or benign. Okay, benign tumor meaning the tumor can grow but will not spread. Okay, it is not going to spread to other parts of our body, but cancerous tumor is, meaning it can grow and spread to other parts of the body. And especially say 5 to 10% of cancer are due to the genetically through generation, meaning it passed through the generation of our family. Okay, this is, look at the picture on the left. It is normal cell division. Human are made of cell. This is a healthy cell. Okay, a healthy cell contains nucleus, which is we contain DNA inside the nucleus. And one cell will divide into two divide into four. This is we call cell division, cell renewing system, or cell metabolism. It is how our body to create new cells, and older cells, damaged cells will die. So look at the mutation of cell. Okay, as what you say, cell contain nucleus and contain DNA inside the nucleus. So you see, healthy cells and healthy DNA. All right, but after the free radical attacking of our DNA, then our DNA start to damage. And if the damaged DNA continue to grow, continue to multiply the cells, so it is how our cancer cells start growing. Okay, because if you have damaged mutated cells growing, meaning the lump, okay, the tumor start growing. All right, so let's go for symptoms of breast cancer. Signs and symptoms, okay, may include changes in the size, shape, or appearance of a breast. Okay, when you find your breast, suddenly the shape and the size change from the other. Different from the other.
Jakarta, di CS, ke BCA. Bener kata kamu, kosong ke Jakarta.
I'm so sorry, Ellen. Can you?
Tolong Mia, Amie.
Ini tempat gue nggak ada yang ngantri.
Pak
Okay.
Didi, boleh saya mute?
Alright, so sorry. Let me continue. Okay, when you find out, okay, or suddenly the breast changes in the size or shape or appearance from the other breast. So please look into it. Okay, you check. Next, nipple discharge other than breast milk. Okay, when you find nipple discharge, okay, maybe including white discharge, yellow discharge, okay, or pus, even blood, then please go and see doctor. All right, next, a newly inverted nipple, meaning the nipple sunken in, suddenly sunken in. Also, it is going to be serious. All right, and peeling, scaling, crusting, or flaking of the back pigmented area of your skin surrounding the nipple, meaning areola. Okay, the skin area surrounding the nipple become peeling, scaling, okay, change of color, then please look into it. Next, changes to the skin over the breast, such as dimpling. Okay, we are not going to have dimple in our breast, all right? It is abnormal. Okay, and redness or pitting of the skin over the breast, like the skin of an orange. Look at the picture. It is actually not an orange. It is a breast, but you see it looks like a orange. It looks like an orange. So it is not going to be normal. All right. A breast lump or thickening that feels different from the surrounding tissue. So when you check your breast, if you find a lump or thickening skin tissue inside your breast, okay, it is not going to be normal as well. See doctor. Okay. So next, let's look at the risk factors. Factors that are associated with an increased risk of breast cancer, including number one, being a female. Yes, women are much more likely than a man to develop breast cancer. All right. Number two, increasing age. Yes, as we age, the risk of getting breast cancer is higher. Number three, personal history of breast cancer. If you have been diagnosed with breast cancer before, then you are more likely to develop a new cancer in the same breast or the other breast. Okay. Number four, a family history of breast cancer. Okay, meaning if your mother, your sister has diagnosed cancer before, then the risk of getting breast cancer also higher. Number five, obesity. Yeah, obesity, fat. Okay, because fat stores estrogen. What is estrogen? Estrogens meaning female hormone. Yes, extra female hormone will flow into bloodstream and eventually stimulate breast tissue and lead to develop a breast cancer. Okay, number six, begin period at a younger age. Okay, menstrual cycle. All right. If you begin your period before the age of 12, meaning you are at the higher risk of getting a breast cancer. Number seven, begin menopause at an older age. If you begin menopause after the age of 55, you are at higher risk of getting breast cancer. Okay, why? Because you get more estrogen in your body. All right. Number 8, having your first child at the older age. Women who give birth to their first child at the age of after 30, they have an increased risk of breast cancer. And number 9, having never been pregnant. The more menstrual cycle you encounter, the more estrogen you produce in your body. So it is also due to the increase of the risk. Number 10, postmenopausal hormone therapy. Okay, women who take hormone therapy medication, okay, also have an higher risk of getting breast cancer. But the moment you stop your medication, the risk decrease. Okay, number 11, drinking alcohol. Okay, because alcohol will increase the estrogen in your body as well. So come to prevention. How to prevent? All right, making changes in your daily lifestyle, okay, will help you to reduce the risk of getting breast cancer. Number 1, limit alcohol consumption and quit tobacco smoking. All right. Number 2, maintain a healthy weight. Don't let yourself to be obese. Number 3, choose a healthy diet. Eat a diet which is rich in vegetables, fruits, and whole grains. Limit consumption of sugar, red meat, or processed meat. Okay, number 4, exercise most of the day. Enough exercise would help in maintaining estrogen in healthy level. Okay, we want a healthy level of estrogen. We don't want extra excess of estrogen. Number 5, become familiar with your breast through your breast self-exam for breast awareness. Okay, if there is okay signs in your breast, please check with your doctor. Limit postmenopausal hormone therapy. To reduce the risk of getting cancer, you need to lower down the dosage of hormone therapy, or possible shorten the period of the hormone therapy. All right, number 7, breastfeed your baby. Okay, estrogen level decrease while a mother breastfeeding baby. So come to CellAge Plus. How does CellAge Plus help us in preventing cancer? Okay, but before that, please bear in mind, CellAge Plus is not a medication, it is not a drug, it is not an injectable product. Okay, it is only plant-based, all natural plant-based product, which is you can eat it, you can consume it anytime, anywhere you like. Okay, yet affordable. So let's look into the ingredients. Okay, total we have 17 ingredients in CellAge Plus, all plant-based. But I have picked up a few which can directly help us in anti-cancer. First, organic young wheat grass. Look at the red box. I have highlighted in red box. Could help kill cancer cells. Okay, other than giving us nutrients, other than giving us amino acid, other than immunity, detox, yes, it can help us to kill cancer cells. All right, number 2, Fucoidin. Fucoidin is brown algae, brown seaweed. All right, look at the red box. Studies suggest that it can prevent the growth of cancer cells. Okay. Quasatin. Quasatin is a flavonoid. All right. It can help us to fight free radical. It can reduce inflammation, but also reduce the risk of cancer. Okay. Curcumin. Curcumin is turmeric. Okay, turmeric can help us to prevent cancer and even can help us to treat cancer. Okay, other than that, the benefits can help can help us to go against depression, even to fight over the chronic diseases. But today, our topic is breast cancer. So look at it. It can help us to treat cancer. Super berries. Okay, we have 6 types of berries. Red grapes. What is the benefits of red grapes? Okay, it can help to protect against chronic diseases such as diabetes, colon cancer, and breast cancer. Okay, next, strawberry. Okay, strawberry can protect against several types of cancer. Okay, let's look at raspberry on the right. Can help to prevent or reduce the risk of chronic diseases, including cancer. And cranberry. Cranberry can prevent stomach cancer and stomach ulcer. Okay, so look at the berry itself. They can prevent so many types of cancerous. Okay, next, Rom, please. So after the ingredients of CellAge Plus, I need to emphasize another important point, which is abscisic acid. Okay, you can call it as ABA. Because the ingredients, the plant of CellAge Plus contain abscisic acid, ABA. So ABA is actually a substance from the plant, and ABA can talk with the ABA inside our stem cell. Okay, next, please. So what do I mean? Okay, let's look at the first picture on the left. It is actually all the stem cells inside our body. All right, with the ABA from CellAge Plus. Okay, the ABA able to crosstalk, able to communicate with our ABA inside our body. And where is our ABA inside our body? It's inside our stem cells. So when ABA talk to our ABA, it is actually reactivating our stem cells. Okay, our stem cells inside our body already sleeping, hibernating, not functioning, not working because we are aging. Okay, so we need ABA. Okay, ABA from CellAge Plus will talk to our ABA in our stem cells, and again, they reactivated and eventually to produce more stem cells, proliferating. Okay, meaning they produce more stem cells for us. Okay, next. So what is stem cells? Why is it so important? All right, okay, see, stem cells can make more of themselves. Okay, meaning stem cell itself, they can be muscle cell, they can be bone cell, they can be blood cells, skin cells, even immune cells. All right, and again, it will be unlimited regeneration, meaning they can produce, they can regenerate to produce more new cells for us. Okay, and they can become almost any cells and multipotent differentiation. Okay, look at the picture. Stem cells in the middle, the blue color cell is stem cells. When the stem cell travel to muscle cell, it can be muscle cell and repair the muscle cell, regenerate the muscle cell, meaning to produce new cells, keep producing. All right, so when the stem cell travel to your bone, travel to your skin, it will become a bone cell and skin cells, also repairing and regenerating. Again, immune cells. Today, I want to emphasize immune cells. Yes, everybody, okay, we have immune system. And our immune system are talking about immune cells, how active your immune cell is, how efficient your immune cell is, how many immune cells you have in your body. So today, stem cells can travel to your immune cells and become your immune cells, to repair your immune cells, to regenerate your immune cells for you. Okay, next, please. So where is your immune cells? Here. This is all your immune cells. Look at the purple circle. Okay, your immune cells included natural killer cells, included T lymphocyte, included B lymphocyte. And where do all these immune cells from? Okay, then you have to look at hematopoietic stem cells. our body, every one of us, we have hematopoietic stem cells inside our bone marrow. All right, the function of hematopoietic stem cells is to create immune cells for you. Okay, then look at natural killer cells. Okay, natural killer cell and T lymphocyte. Okay, both of these are the immune cells. And do you know that these immune cells function is to kill the cancerous cell? Okay, especially natural killer cells. Okay, so you have a weapon inside your body to kill the cancerous cell for you. Okay, so the matter is, do you have enough NK cells? Do you have enough T cells? Do you have enough B cells? Okay, not enough. It's okay. You have hematopoietic stem cell to produce the immune cells for you. The problem is only they are sleeping, they are hibernating. So today you need CellAge Plus will be able to reactivate these hematopoietic stem cells. All right. Next, mesenchymal stem cell. What is mesenchymal stem cell? Mesenchymal stem cells are the stem cells who target only solid part of our body, your bone, your cells, your skin cell, your organ cells, okay, to regenerate, to repair. That is also the reason why all those celebrities, they go for stem cell injection. They go for mesenchymal stem cell injection. Okay, but today we are not going to talk about mesenchymal stem cell. We talk about hematopoietic stem cells because hematopoietic stem cell can produce natural killer cells for you, can produce T lymphocyte cells for you to go against cancer cells. Next, please. Rom. Okay, look at immune system. Okay, the function of it, I have highlighted in red box. Destroy abnormal cells, destroy cancerous cell. Okay, so see, actually everybody, if you have the good immune system, if you have a balanced immune system, your immune system can actually work for you, okay, to destroy the cancerous cells inside our body. Okay, next please. Researcher and formulators. Okay, who are the researchers and formulators? Dr. Anne Steele. Okay, Dr. Anne Steele is heart specialist, and she is also one of the first scientists who used the stem cell to treat the damaged heart. All right, even to treat the heart after transplantation, meaning after the heart being transplanted, so she cultured the able to maintain the health of the heart. All right, she then think, okay, how to prolong the lifespan active. I'm so sorry, my line cut off, right? Let me continue with Dr. Mark. Okay, who is Dr. Mark? Dr. Mark is the dean, the founder, and the chairman of the board at the University of Natural Medicine in USA. Okay, after practicing over 30 years of natural therapy, he doesn't encourage people using drugs to cure illness. He encourages people to maintain health by using natural therapy, by using health food, functional food. Okay, next please, Rom. Phenomenal program by our researcher from our formulators. They would rather suggest you, if you want to start your CellAge Plus, please go for your 3 months program or 6 month program. Okay, 3 months programs is to maintain your health. It is good enough to awaken the stem cells in your body and proliferating to produce more stem cells for your body. But for us, who are aging or chronic diseases, okay, they would rather to encourage you to pick up the 6 months program, because after waking up the stem cells, after proliferating the stem cells, they will start to repair the damaged cells inside our body, and they will start to regenerate more cells for us. Okay, next please. Here the end of my presentation. I hope every one of you get some general knowledge about breast cancer. So
Thank you very much, Dr.
thank you
Amie.
very much.